Hi, my name's Trey Griffin. I created a case study with RJ and Branden Voytko about the skin and sensory systems. A male geriatric patient was delivered to the emergency room via ambulance with what appeared to be severe burns across the anterolateral portions of his right upper extremities and portions of his right trunk, with the most severe damage appearing to be focused on the distal ends of the right upper extremity. The EMT stated that the patient was found by his wife in a state of syncope on the floor of his kitchen and a large flame around a pot of what appeared to be boiling oil. The EMT suggested that the patient is immediately administered antibiotics due to the severity of the burns on the distal extremity.
Upon further superficial evaluation in the ER, it was noted that the patient was alert and responsive despite showing signs of lethargy. His vital signs were normal except for a hypotensive reading of his blood pressure, prompting intravenous fluid to be administered immediately. Further testing revealed the patient to have signs of neurological damage associated with peripheral neuropathy, indicating third-degree burns of the right hand. This is further supported by paresthesia as reported by the patient and no further sense of sensation in the affected body part. Overall, the total amount of burned skin on the patient accounts for about 8% TBSA, taking into account the minor burns located on the extremity and the anterolateral portions of the right trunk. Palpitations of the right wrist above the severely damaged hand resulted in edema, indicating fluid in the dermis.
Treatment for this patient includes the continuous administration of antibiotics to combat the possibility of infection until observed from a physician specializing in burn treatment. Most importantly will be to perform a skin graft on a patient's severely burned sections of skin once deemed appropriate by the specialist. Treatment of the epidermis of the grafted portions of the skin is necessary as well immediately after transplantation, as there is still risk of infection until all wounds are completely healed. In conclusion, we are dealing with an older man who has suffered third-degree burns to his right arm and lower forearm, as well as minor burns to the rest of his right extremity and the side of his right trunk. EMTs treated the man immediately on site and was transported to the ER for further evaluation, and upon further evaluation at the ER, he will be sent to a specialist for further treatment.